Now we're going to talk about integrating multi-level approaches to promote community health. So you've already heard about a community and a population, but let's just have a little review. A community is a group of people who share something in common, who interact with one another, and who may exhibit a commitment with one another. A population, or an aggregate, is a group of people who have at least one thing in common and who may or may not interact with each other. As you learned from the discussion about the intervention wheel, interventions that encompass the multiple levels will be more effective in impacting the health of populations. The shift from thinking about illness, as in the biomedical model, to thinking about degrees of health allows a nurse more flexibility in practice approaches with the goal of promoting greater levels of positive health, and it is holistic in nature. As discussed earlier, the multi-level interventions are more likely to assure positive outcomes for the population. This is an integrative model for community health promotion. Be sure to note the connected spirals indicating the fluid nature of the process. Notice the blue arrow that just popped on your screen. This shows the fluid nature of the process, that it goes back and forth. It just doesn't stay in one area stagnant. Our concept of health, and later with it, health promotion, has changed over time and has been cyclic in some ways. In your text, you might want to view box 17.2, page 378, for an overview of health perspectives over time. Definitions of health, which are another word for models of health. Clinical health. What do we mean by clinical health? We don't mean just the absence of disease, but this also includes the physical, mental, and psychosocial well-being. Role performance health. This is linked to a person's ability to perform his or her social role. Adaptive health. This is flexible adaptation to the environment. Eudaimonistic health, tough word there. Attaining one's greatest human potential or self-actualization. Population health. This is a term used by the Institute of Medicine. This describes the health of the population measured by displays of health levels that is impacted by economic, social, and physical environments. When we speak about health promotion, it is important to realize there is a differentiation between health promotion, which are behaviors that achieve the greatest level of health, illness prevention, these are behaviors that focus on reducing the risk or threat of disease, and health maintenance. These are behaviors focused on keeping our current state of health. In understanding, you can see that a singular health behavior can be attributed to each of these three reasons. For example, you may walk because you want to increase your lung capacity or build your muscles for health promotion. You may walk for illness prevention because you want to reduce your cardiac risk since your mother had an MI shortly after gaining postmenopausal status. This would be illness prevention. Or you may want to maintain your current level of health and you have always walked 2 miles a day since you were a teenager. The notion of self-care has fallen in and out of favor of time and now is back in our vocabulary. But rather than relying simply on your own diagnosis and treatment, we refer now to working in conjunction with healthcare providers but taking an active role. Disease management addresses illness care that ensures tertiary prevention and minimizes negative outcomes from the disease.